Before proceeding to the physical back exam, it's important to assess your patient's back pain history. This core back tool explains a series of 5 questions designed to help you determine the pattern of back pain along with other potential medical conditions associated with back pain. Dr. Flannery will be using this core back tool throughout the video. Please review these questions with your patients and use this tool as a guideline while administering the lower back exam. For a hard copy of the core back tool, please click on the link below to download a copy or visit our website.
Hey everybody, I'm Dr. John Flannery, and today I'm going to be teaching you on the practical, positive, pragmatic examination for the low back to help determine which back pain pattern you've just finished with the core back tool. So Bob is going to help us demonstrate the different components of it.
There are 5 components to this physical exam, which will be demonstrated by Dr. Flannery in this video.
So first, I'm going to do the inspection component, and there are 3 parts to that. So Bob, if you can please stand in front of me.
Sure.
So we look at the anterior or front, from the side and then from the back. And we're looking at his spinal alignment to sort of get a good sense of where his pain is coming from and which pattern of back pain he is experiencing. So initially, I'm just going to have you stand in front of me and I'm going to look at Bob. I'll get you to turn just a little bit. And what I'm looking for is his overall alignment, how his head is on his shoulders. You can grab the gown and just lift it to mid-thigh. Excellent. I'm looking at the muscle bulk of his calves and of his thighs and of his feet. That helps me make sure what kind of alignment he has. Now I'm going to get him to turn 90 degrees so I can look at him overall. So at this point in time, undrape him with his gown so that we can have a good view of him from the side. And what I'm looking for now is his cervical spine, his lumbar spine, but overall I'm looking for this alignment from his ear to his shoulder, and his shoulder down to his pelvis, and then overall from that all the way to the ground, because that overall alignment is critical for me to understand if his head is in a bit of a forward thrust and how this back may be compensating. So as you can see, his ear is a little bit anterior to his AC joint and a little bit anterior to the pelvis and quite a lot down into his ankle. So he's got a bit of a head thrust or an anterior head carriage. Now I'm going to look at him from the back. So Bob, if you can turn towards here. And I'm going to look at his overall alignment for his shoulder blades and his head, how his pelvis is, and put my 2 hands, Bob, I'm just going to palpate your pelvis. 2 hands on the top of his pelvis, which is nice and square. I look at the 2 dimples here over the sacrum to sort of see if they're stable, as well as now the posterior part of his thighs and of his calves and into his feet. So I've a good overall alignment for Bob from the top of his head all the way through his spine into his legs. So now we're going to go into the next phase of the examination, which is his gait and muscle power. Now I'm going to look at the gait component of it. So I'm going to watch Bob walk 3 steps back and forth. Bob, can you walk 3 steps? I'm looking at his overall pattern, his wideness of his gait of the base, and now I'm going to look specifically at power. And the power that I'm looking for is of his S1 and his S2 myotones. I'm doing a motor test. I'd like you to walk on your tippy toes. This gives me an idea of your overall strength. So I'm focused primarily on the S1 and S2 myotones, as well as the strength of his gastroc muscles. You can see he's quite strong with those. Now, Bob, I'm going to get you to walk on your heels 3 steps. Now I'm assessing the L4 and the L5 myotomes. And again, you can see that he's got excellent strength, and I can actually see both of his extensor hallucis tendon and his tibialis anterior. Lastly, Bob, I would like you to do a squat. So if you can just come, put your hands on your hips, and just mirror what I do. I want you to do a good deep squat, down all the way and back up. By doing that, we get all of the musculature, including L2, L3, and L4, in a good assessment, as well as the other ones. So now we're going to do range of motion of your back, which is one of the critical aspects. So Bob, can I get you to leaning forward? I want you to put your legs any distance apart and just lean forward and try to touch your toes and tell me if you have any pain. So you can see he's got good range of motion. Was there any significant pain or discomfort?
No, a little tight, that's all.
A little tight, okay. Now I'd like you to put your hands on your buttock, and I want you to lean back as far as you can. And how about that? Does that cause your pain?
Yeah, that's sore, right? Lower left.
So he's got some discomfort in his back when he leans back. That helps us to understand Bob's back pain pattern seemed to be worse when he was extending. He had a little bit of stiffness when going forward, but primarily when he was leaning back, and that fits for a pattern 2 back pain. So Bob, now I want you to slide your right hand down your right side, and I want to see how your spine moves. And again, I'm inspecting to watch if there's any motion difficulties. Now the same on the other side. And what happens when you do that? Any pain or discomfort?
Yes, lower left.
So always in that area?
Yes.
Okay. So now, Bob, I'd like you to cross your arms over your chest, keeping your feet still, so I don't want you to rotate. I want you to turn and look at me over your right shoulder. Excellent. And now, Bob, I want you to lean over your left side and look me in the face.
That's
Again,
sore.
you're getting this pain in that discomfort.
Yes, same place.
So he's getting low back pain primarily on both sides, a little bit more on the left. So that completes our range of motion, and the back pattern that we've seen so far seems to fit with pattern 2. So now, Bob, can I get you to sit down, and we're going to now do the next stages, which is looking at the motor exam, the reflexes, and the sensory component. I need a reflex hammer, and I'm looking for his reflexes here for the L3-4 reflex, the knee reflex, for the S1-2 reflex, and for the L5 reflex, the hamstring. So gently tapping with the reflex hammer, you can see that he has a nice good reflex on both sides. They're intact and they're symmetrical. For the ankle jerk, I can see that his ankle has got a nice response, and that's the S1-2. Lastly, the L5, I cup his leg in my knee, and I grab his hamstring with my 2 fingers, and now I hit his hamstring, and I can feel and see his hamstring. I'll just do it on the other side. Same aspect. I cup his knee, and my fingers on his hamstring. I can see and feel that he has a very good hamstring reflex. I'm going to do one more component of the neurological exam, and that's the Babinski. I am now getting an assessment of whether or not he has any upper motor neuron features, and his Babinski is normal on both instances and not abnormal. At the same time, I just finished doing a straight leg raise serendipitously. So I know that he can get his legs to 90 degrees in the seated position. My last component is the sensory exam. So now I'm assessing the dermatomes, and there's 3 main dermatomes that I really want to look at: L4, L5, and S1. They're the 95% of all of the radicular patterns that we may see. And those areas also overlap with peripheral nerves. So this area is the L4 dermatome, this area is the L5, and this is the S1. And so I check with Bob. Bob, this is what it feels like, a cotton swab.
Yes.
I want you to close your eyes and tell me if you can feel me touching you on this spot here,
Yes.
this spot here,
Yes.
and this spot here.
Yes.
Did any of them feel abnormal?
No, it felt like the swab.
I would do the same on the other side, establishing that he has intact dermatomal sensory. Now that we've completed our sensory, our motor, and our special reflex examinations, I want Bob to lie down. So Bob, I'd like you to lie on your back. I'm going to get a pillow for his head, and I'm going to get a sheet to ensure that he is feeling comfortable. At this point in time, I'm now going to examine his hip, knee, and ankle range of motion. So Bob, can you bring your knee up towards your tummy? Getting him to initiate the action allows him to be in control. And I'm going to internally and externally rotate the leg and bring it back down. Bob, can you do the same with this one? I let Bob lift his own leg, so I'm not forcing it. And I do the external rotation, the internal rotation, so I know his hip is functioning quite nicely. And you can see he's got excellent range of motion of his knee, and it's not exacerbating any of his pain. Fully extend that. Now I just finished with his ankle. He's got good range of motion in his ankle. So that tells me that there are no contributing components to his back pain coming from his hips, knees, or ankles. Now we're going to go into the next phase, which is palpation of his lumbar spine. So I need Bob to turn onto his tummy, and I always put a pillow underneath his abdomen to ensure that we don't exacerbate any of the facets that might be painful in his back. So now with proper draping, we can establish good view of his back. And so I'm just going to palpate. Bob, I'm going to be pushing on your back.
Okay.
You can tell me if there's any pain or discomfort. Okay. Often at this point in time when I'm doing the palpation of his muscles of his back, I want to make sure that I'm examining his pain. So I jokingly say to him that he's now welcome to my torture changer, Bob, because that chamber is going to be where I'm going to be looking for your pain. So I'm palpating through his lumbar spinous process, and they feel they're intact and there's no abnormalities. Now I'm going to move off to the paraspinal muscles in that region, and I can sort of feel down in through here. And there was some pain or discomfort that looks like right in this region, which is on his left side. Similarly, I'm going to now palpate his glutei or buttock muscles, and if I was necessary, if he had some pain radiating down into his thighs, I would palpate those. But just for demonstration, I find the top of his pelvis, here's his trochanter. I know these muscles right here are his gluteus minimus, and this side is not too bad, whereas right now when I'm palpating over here, he has some discomfort. So we know he has some pain in his back that was back dominant, and that's an area that we're looking for. One last special test that we're going to do is make sure that the femoral stretch test is reasonable. So I put my hand under his thigh, and I bring his leg up into extension. Bob, is that creating any electrical shocks or any unusual features for you? Similarly, on the other side, I grab his knee and I lift it up. So his femoral nerve stretch is negative on both sides. If he had muscle palpation or pain that was going into his calves, I would palpate that region. So that concludes our practical, positive, principled examination of the low back using the core back tool and our patient who was able to demonstrate to us that we actually had a pattern 2 or extension-related type of back pain. He had pain on his extension. We found that he had pain on some rotation in that area, primarily located on his left side, and seems to have a fair amount of muscular component as demonstrated on the palpatory exam. So I hope you found this informative and can help you to move forward in proper assessment for people with acute and chronic low back pain.
This video is brought to you by Echo Chronic Pain and Opioid Stewardship at UHN. To find out more and explore resources available to you from this program, please click on the link below, visit our website, or scan the QR code.